afternoon, ladies and gentlemen. I'm Sunit Kabaria, Director of Community Health for Robert Wood Johnson University Hospital, Somerset. Welcome to today's webinar on kidney culprits and COVID complications, presented in collaboration with Friends Health Connection. As a result of the COVID-19 pandemic, we are seeing an increase in individuals with kidney damage. During today's webinar, we will discuss how COVID-19 impacts the kidneys and signs of kidney problems. We will also learn about the role of kidneys in our overall health and tips for keeping the kidneys healthy. We are pleased to be joined today by our special guest, Dr. Sunit Kabaria, a nephrologist with Robert Wood Johnson University Hospital, Somerset. We will begin our webinar with about 20 minutes of a moderated conversation, followed by questions and answers from our audience. So once again, thank you so much for joining us, Dr. Kabaria. I appreciate it.
You're welcome.
Why don't we begin by you telling our audience a little bit about yourself?
I'm a nephrologist, and for people who don't know, that's somebody who specializes in kidney diseases. We also treat a lot of resistant blood pressure problems as well. I've been in the area for almost 20 years now, and the last 12 months have been challenging as we learn a lot about COVID. And the effects on the body in general, and specifically in my specialty, the effects on the kidney as well.
Thank you so much for sharing. So can you give us maybe an overview of like the role of kidneys in our body and how they function?
Sure. So I think most people know, to make a general statement, that the kidneys produce urine. But the urine has two functions. One is clearance of toxins. And unfortunately, the only way you know for the most part that the kidneys are not filtering toxins appropriately is to make sure that you get blood work done at least once a year, if you're otherwise healthy, just to monitor that during a checkup. And then the second function is clearance of water and fluids. And that is much easier for the patient to notice. Because you would notice swelling of the face or swelling of the legs, decreased urination, things of that nature. And so those are the two main functions: the clearance of toxins and the clearance of fluids from the body.
Okay. So among the long-lasting health complications that can be caused by COVID-19 is kidney damage. How prevalent is kidney damage among those who have severe cases of COVID-19?
Right. So, I think that as we sit here 1 year later, what we call the incidence of kidney disease with patients with COVID, meaning the number of patients that develop kidney issues, is significantly less today than it was a year ago. And I think that partly goes back to, our colleagues are much better able to treat COVID symptoms. We're seeing much less, death, morbidity, shorter hospital stays for patients who have COVID today than the unfortunate circumstance we had last spring when we knew very little. And so I think a lot of what happens with the kidney in the short term in the hospital really has to do with the severity of your COVID symptoms. And so if you develop really severe COVID symptoms, you end up, unfortunately, in the ICU or on a ventilator. You're more likely to develop kidney problems just because your whole body gets affected, as opposed to those patients who respond well to treatment and clinically improve. The biggest factor I think that we see usually is for those patients that have other medical issues, specifically issues with kidney function to begin with. I think that those patients are at highest risk.
Okay. So then how does COVID-19 actually damage the kidneys?
Right, so we're learning a lot, and we don't know so much as far as long-term because it's only been 12 months. But in fact, they've done biopsies. Now we've had 12 months of experience, and in patients that develop kidney issues, we've done biopsies, and there's evidence that COVID is in the kidney, actually. And so, it's basically an immune syndrome. It's an immune activation. A lot of kidney diseases are immune activation syndromes. But I'll tell you that I think the majority of people who have normal kidney function, who are otherwise healthy, they tend to recover. in the short term. In the short term, I mean 12 months. Those patients that have preceding kidney issues or severe diabetes or uncontrolled blood pressure, those patients are at higher risk of possibly developing more severe kidney issues and then potentially not recovering. However, it's still early. And, we have had patients who have required dialysis. We've had patients who have improved. We have patients who have continued to require dialysis. And I think a lot of this is, unfortunately, we need 3 to 5 years to follow these patients to determine whether or not these are long-lasting effects or short-term effects from COVID. But certainly it is a multi-system disease and it affects the whole body.
So we know that COVID can also cause blood clots. So does this have any impact on the kidneys?
It has a indirect impact. So meaning that if somebody develops blood clots and they go to the lungs or affect the heart in any way, cause issues with the limbs, those indirectly will make the patient sicker. By being then admitted to the ICU, it can affect the kidneys. In theory, there could be blood clots to the kidneys, though there are no case reports of that I'm aware of.
So, then what are signs and symptoms of kidney damage? What should we look for, and how is that diagnosed?
Sure. So unfortunately, as I started the whole conversation was that the kidney has two functions, right? And so the first one is clearance of toxins. Well, unfortunately, unless somebody has really severe kidney disease, you're not going to really get symptoms from that like you would if you had other diseases. So really, the important thing is to make sure, now when you're in the hospital, you will get blood work frequently, but it's also important that if you've had COVID, that you go for your physicals, you make sure you get your blood tests. Assuming the kidney function is normal, the second part of that is that and I think this is the thing that's forgotten, you should ask your family doctor when you do your physical to do a urine test as well. Many times the earliest sign of kidney damage is if there's protein or blood in the urine. And the kidney function can be normal, but having protein or blood in the urine can be a very, very early sign that the kidney is affected by some disease. It could be COVID or it could be something else. And then in more severe cases, the second effect of the kidney is clearance of fluid. So patients will notice fluid retention, leg swelling. They can notice that their blood pressure is more difficult to control, becomes elevated because of salt and water retention. But that tends to happen with more advanced cases. And so unfortunately, I can just kind of stress the importance again of even if you're healthy, just make sure that you get your yearly physical done with your blood work and your urine testing to catch things early.
Okay. So can the kidneys recover after somebody has COVID-19? And what are the treatment options for that?
Yeah, so the majority of people who have been healthy and had normal kidney function, who develop abnormal kidney function when admitted to the hospital, the great majority recover. There is no specific treatment when it comes to the kidney other than treating COVID systemically. And that, that's all evolving. We've learned to use steroids. We've learned to use medications like remdesivir. We've learned to use antibiotic cocktails. All those things are good to treat COVID in the body, which also helps the kidney. And so I think that the outcomes for people who have normal kidney function, who are otherwise healthy, usually are good. Most of those patients have recovered and will have good kidney health going forward. The problem has been in patients who have had moderate to severe kidney dysfunction and then get inflicted with COVID on top of that. Unfortunately, we've had a few patients that have required dialysis after they developed kidney failure, and some of those patients did not recover because of the preceding injury that they had from other diseases prior to getting COVID.
Wow. So then if you already have kidney disease, what precautions should you be taking to avoid getting COVID-19?
Right. Yeah. And that's public health. And that's what we've all been talking about. I think that, we've been big proponents of vaccination. It prevents severe illness. It prevents hospitalization. It does not prevent disease by itself, but it's important to keep up with your vaccinations. You know, I think everyone wants to socialize, they want to be active, and we want everyone to be active, but you have to use your best judgment. Once you're vaccinated, who you're around, what are the risk factors. You know, mask wearing has been shown to be beneficial, a good quality mask to prevent transmission when you're in public areas. So a lot of the public health measures, as far as what we've been doing, are the same. And beyond that would be, you know, if you have diabetes, it's important to control your diabetes. If you have high blood pressure, it's important to work with your doctors to make sure those things are controlled, so that in the unfortunate event that if you do get an infection, you're in better health going into that, so that the chance for complications is significantly less. And most importantly, I think, is that I think people have to remember that, you know, once you're vaccinated, it doesn't mean you can't get an infection. So I think that if you have any symptoms or concerned about it, make sure you get tested. Because like I said before, we have good treatments now and we can prevent complications, but we have to, you know, most of those treatments are best when they're started early. And so if you do have a lot of medical issues and you do have any symptoms, just like you would get tested for the flu, it's relatively easy to get tested. Even if you had the vaccine, just go get tested, talk to your doctor. That way, if you need treatments, you can get them earlier before you get sick.
Okay. And just a clarifying question, when you're talking about public health guidelines, just to be clear for our audience, those are what we call here at the hospital, the 4 W's, right? Wearing your mask, washing your hands regularly, maintaining your distance, and staying sick when home, correct? That's what you were referring to?
Absolutely.
Okay. Yeah, I just wanted to clarify that for our audience. So in addition to having COVID-19, what are other risk factors for developing chronic kidney disease?
Yeah, so then, you know, in this country, unfortunately, diabetes is the main risk factor, and high blood pressure. So if you take diabetes and high blood pressure as causes, you're probably going to encompass 90% of patients who have kidney issues, with diabetes affecting the kidney, affecting the whole body more commonly. You know, we have a lot of medications in our arsenal, but you should work with your family doctor, your diabetic specialist, to control your glucose. That's going to help prevent long-term complications. Blood pressure is a little bit easier because patients can check their blood pressures at home and make sure they're controlled, and you can work with your doctor to do that as well. But I would really want to stress the importance of diabetes control.
Okay. So, all right, so we talked about risk factors, but what actually causes chronic kidney disease?
Right, so it's the kidney disease. You know, there are unfortunate cases which people have kidney disease related to immune disorders, hereditary disorders. There's things that cause numerous cysts in the kidney called polycystic kidney disease. All those things you can control. Most of them are what we call idiopathic or heredity. And, you know, those things are caught. But like I said, they're caught early when you get your annual physical, you get blood work, you get urine tests. And sometimes the blood work is normal, and people will find a little bit of protein or a little bit of blood in the urine, and that can be the earliest sign. But the great majority, greater than 90%, are common disorders like diabetes and high blood pressure that cause that. And so it all comes back to, you know, what can you control? Okay. You can't control things that are hereditary or that are idiopathic and don't have, you know, don't have any secondary causes. But unfortunately, diabetes, high blood pressure are very common in society, and are the most common causes of kidney problems. And those are the things you want to look after yourself.
Okay. So then what are some tips for promoting good kidney health?
Yeah, so, you know, for most patients, adequate fluid hydration, you know, water intake. You know, we also have learned that unfortunately, there's just no symptoms until you get severe disease. And so, you know, if you have abnormal blood work, if you have an abnormal urine test, take it on yourself to ask the right questions, you know. And I think most people nowadays have access to their lab results, either online or through a portal or something. So take the time, look at those results, educate yourself. And if you see abnormal results, discuss it with the doctors, because I think, taking your own health, controlling your own health, controlling yourself is probably best for your health long term.
Okay, so I know you mentioned about going to your doctors, and there are some who may be concerned about going to the hospital or a doctor's office during the COVID-19 pandemic. So can you maybe explain to our audience what are some of the precautions that are being taken to protect patients' safety during this time?
Sure, absolutely. So, early on in the pandemic, we didn't know transmission, and we were frequently sanitizing the office, door handles, touch surfaces, in addition to respiratory, And as we've gained experience over the past year, we've learned that the main route of transmission is respiratory, And so it's important that the patient themselves wear a mask, a good quality mask. The other patients wear a mask. The staff is wearing a mask, including the physicians. If you look at literature, if you look at healthcare facilities, there's been very rare reported cases of transmission in otherwise healthy individuals. Now, in my specialty, we deal with a lot of patients who are elderly, over the age of 70, and are very concerned about their health. And so the proliferation of telemedicine has been great because it's allowed those patients to get the health care that they needed without putting themselves in uncomfortable situations. And so I had many patients that we treated through telemedicine over the past 12 months who over the last month or two have now come back to the office after they got vaccinated. And so I understand concerns. I understand that every situation you can't control what somebody else does. But it should not, with the benefits of telehealth, it should not be a reason not to get the care you need. And and that's what's happened. Patients got the care that they needed. They did it remotely. In some cases it wasn't 100% ideal, but we managed, and we all learned because it was the first time we'd been through this. And then after they got vaccinated, they all wanted to come back to the office and have that in-person conversation.
That's great. Well, thank you so much. So at this time, I'd actually like to open it up to questions and answers from our audience. If a member of our audience does have a question for Dr. Kabaria, please post it in the Q&A section of our webinar. And it looks like we already have one for you already posted. So this question is, so unlike other flu-like conditions, which we are already taking vaccinations, COVID-19 manifests more serious, dangerous threats and complications, which might linger longer and become evident over a longer incubation period. Did you understand that, Dr. Kabaria?
Yes, I didn't get the question. So I agree it can linger long. So what's the question that's been asked?
So I guess which might linger longer and become more evident after a longer incubation period. And I think in terms of, I guess it might be, and I guess I can, if this audience member could clarify, I'm guessing, is it the COVID complications and threats in general? So more serious than, yeah.
I agree. Influenza has been around a long time, right? And what do we learn? We learn through experience. And there's a lot of literature written on patients who got infected with COVID and have had long-term symptoms. Mm-hmm. We have patients who had COVID who developed mild COVID, developed mild symptoms, but then a few months down the road have different symptoms. And the problem is that when you look at viruses in general, it's very hard to quantitate what those long-term effects are until we get more experience. And so, in this country, influenza, other viruses are still deadly viruses. But I would argue that if you look at the efficacy or the effectiveness of the vaccine, it is much higher than other viruses. So, I think technology has played an incredible role. In a short time, we have vaccines that really prevent serious illness, and the effectiveness of the vaccines is significantly higher than influenza or other vaccines.
Okay, so the audience member did clarify to say,
Okay.
how much time do we have to worry for? A year, 2 years? And I'm guessing this is kind of like in pertaining to somebody who may have had COVID and is
Right.
maybe thinking about PACS, right? Post-acute COVID syndrome.
Right.
So
So when you look at organ injury, I would say within the first few months, once you get out 1, 2, 3 months, we're not really seeing, unless people get a repeat infection or other complications, you don't see it. So I think there are post-COVID syndromes which are severe. They can, they've affected the heart, they can affect different organ systems. But I think that if the question is that how long do you have to be vigilant that you don't get secondary effects? And I would say if you feel well, and if you're 1 or 2 months out from recovered from COVID, I think there's a good chance that now you're recovered at that point.
okay. So our next audience member posed this question: is the treatment for COVID for a patient with 1 kidney and a GFR of 30 similar to the treatment with a patient with 2 well-functioning kidneys?
Yeah, so the actual treatment is the same, but the medications are dosed differently because of so what the person is asking is GFR is how well the kidneys function, or percentage of kidney function. And so certainly drugs are cleared by the kidney, so the drugs have to be adjusted, the dose. But we've learned that all these medications are safe to use. Whether it be remdesivir, whether it be the antibody treatment, steroids, are safe to use in patients with mild, moderate, and even severe kidney disease.
Oh, that's great. Thank you for that.
But I will clarify one thing, is that if you have medical issues, chronic medical issues, or GFR of 30 puts you in at least moderate to severe category of kidney disease, see, that's another situation where you want to get diagnosed early, because you're at a higher risk of complications. And the sooner you get treatment, here at the hospital, we were giving treatments of antibody treatments in the emergency room. And I had a few patients that were diagnosed that called me. We sent them to the emergency room. They got treated in the emergency room. They got discharged. And within 48 hours, they were significantly better. So we're learning a lot about the treatments, but I'm very impressed with the results of how patients are recovering quickly from that. But early diagnosis is important.
Great. Thank you for that. So this question goes back, clarifying question to something you mentioned earlier on how to promote healthy kidneys. So you had mentioned that hydration is key. Is there specifically an excess of any specific beverage that you should not ingest, such as caffeine, which could, prolonged consumption actually damage your kidneys?
Right. So, the commercially available beverages, none of them specifically damage your kidneys. However, if you have high blood pressure or heart disease, a lot of sodas and things like that have high levels of sodium. If you have kidney disease and your potassium is elevated, fruit juices and things like that are high in potassium, so you should avoid those. If you have advanced kidney disease, the dietitians will encourage you to avoid phosphorus, which are dark sodas, which have a lot of phosphorus. So a lot of what you drink, it is in relationship to your kidney, but it's also in relationship to your other medical issues. Certainly if you're a diabetic, you shouldn't, we don't want you drinking concentrated juice or concentrated soda that has a lot of sugar in it. And so a lot of, unfortunately, it's not a blanket answer. It really matters on what your other medical issues are. But, I think nowadays, I encourage my patients, we have water, we have, people don't like to drink water. We have water flavored water. There's so many different things. But take a minute, look at the bottle. Make sure that it doesn't have a lot of sodium in it, or doesn't have, it's not flavored with sugar, so it doesn't have calories that you don't need and stuff like that.
Yeah, definitely read the food label, right? So thank you. Up, and we have another question. So I understand early detection of COVID is crucial. What is the generally accepted incubation period for COVID to be detected after potential exposure? Is it 3 days?
Right. So I think, as you've seen, this has kind of evolved, and we get different answers as we go through the process. But I think most infectious disease specialists are saying somewhere in the range of 4 to 5 days, that if you don't have symptoms after exposure, you should get tested. Now, many times we've had patients who have had a significant exposure, meaning that somebody else tested positive, they were in contact with that person in a closed space or within 6 feet indoors for an extended period of time. We've had patients like that where we've tested at day 3, 4, or 5, have been negative, and then we've decided to retest 4 or 5 days later and have come back positive then. So I think each situation is different. If you have a transient contact versus a prolonged contact, I think you're at higher risk if you have a prolonged contact, and you should be more vigilant in getting retested if the first test is negative.
Okay, great. Any other questions for Dr. Kabaria? Okay, I don't think so. So then if there are no other questions, this will actually conclude today's webinar. Thank you, Dr. Kabaria, for your sharing your insights with us today. We really appreciate great information. Please remember that the opinions expressed here today by our medical expert are not a substitute for advice from your own physician. If you need a physician, please call our physician referral line at 1-888-724-7123. For more information about healthcare services at Robert Wood Johnson University Hospital, Somerset, please visit us at www.rwjbh.org/Somerset. On behalf of Robert Wood Johnson University Hospital, Somerset, we'd like to thank you again for joining us today. Have a great day and be safe out there. Take care.
Thank you.